Today.
Okay.
One of the first things that we need to do this morning is a physical assessment.
Okay.
Okay?
Mm-hmm.
Okay, can you tell me your full name and your date of birth?
Cindy Rudardi, 12/29/70.
Okay. And can you tell me where you are today?
In the hospital.
Do you know why you're here?
No.
Okay.
Yeah. No, I'm just having a lot of pain.
Okay.
Back
So
pain.
Okay, so you know why you're here. You're here for a lot of pain.
Yeah,
We're going to figure out why you have pain.
Okay.
Okay. All right. And who's the President of the United States currently?
Obama.
Okay. All right. So, I'm just calling for anybody, please. All right. So I'm just going to go ahead and look in your eyes. So I have a pen light. All right. Here's my pen light.
Mm-hmm.
Okay. You just look straight ahead. All right. Okay. Okay. And now if you can just follow pen. Okay. Alright. And if you don't mind, I'm going to touch your eyes a little bit, okay? So I'm going to check the conjunctiva. Okay, nice and pink. Alright. And then I just need you to open your mouth very wide for me. Okay? Okay? That's all I have to do on the head, just so you know, guys. Alright. Erin, can you sit up for me for a second? Alright, and we're just need to see your arms, please. Okay. Cap refill, less than 3 seconds. Cap refill, less than 3 seconds. And check the temperature. She's warm, she's dry, she's color appropriate per ethnicity. Okay, and then we're going to do, you can just grab and squeeze, okay? And I'm going to push my hands against yours and you're going to resist me, okay? And now push me, okay? And then you guys will do your range of motion thing that you got to do with the upper extremities, okay? All right, low lungs. All right. All right, thank you for the demonstration. That was really nice, Cindy. You saved me a lot of work. Okay, so for the lungs, first thing you're going to do is inspect the AP diameter, 1 to 2, okay? And then do your palpation for thoracic expansion and tactile fremitus. And then you're going to auscultate. So I'm not going to put these in my ears, so you don't need to use an alcohol wipe. All right. And every time you feel the stethoscope, you're going to take a deep breath, okay? Okay. All right, I'm going to skip a couple spots.
Okay.
Okay, same on the back, okay?
Sorry.
You follow, pretty much when you're listening to lung sounds, you follow the
Scapula.
Scapula. Thank you. So if you can feel her scapula, you're just going to follow it down. I missed a spot over here. Because usually I just go back and forth. If you just follow the scapula around, your landmarks for the backside will be pretty easy. Okay? Alright. Okay, so you guys would have been, while you're doing this, identifying the normal lung sounds, where you're going to hear the vesicular, where you're going to hear the bronchovesicular, and where you're going to hear the bronchial.
Can you point those out for us?
Your vesicular you're going to hear up here. Your bronchovesicular is going to be more like here, and then your bronchovesicular is going to be more on your sides. Okay? All right. And then we're going to listen to your heart. Okay? All right. So your aortic. You don't have to breathe now. I'm just listening to your heart.
Okay.
Okay. Your pulmonic. Okay. And then your herbs is in here. And then you're gonna be underneath here. And then a lot of times if you have, I mean, you don't need to verbalize it, because you have a large breasted patient, like you sometimes need to move to get under. Okay? So then the last one, it would be around here. Okay? You would be identifying aortic, pulmonic, tricuspid, mitral, assess for symmetry. We already did the pulses. We already did the temperature. That's what you have here on heart. But really, your pulses will be done as you go from your head to toe. And then under heart, it also has nail bed. But you're looking at the nail bed color and doing your cap refill when you're doing your extremities, not under the heart section. Okay? All right, and so the next thing I'm going to do, you can lie down for me. I'm just going to listen to your abdomen. So your pain is mostly in your abdomen, yes?
Mm-hmm.
Okay. All right, so where is most of your pain occurring? Okay. All right, so I'm looking to make sure that the abdomen is symmetrical. And then I'm going to listen to her bowel sounds, and then I'm going to palpate. Because you don't want to palpate first, because that might stimulate peristalsis. Okay? So make sure that you don't palpate before you listen. Okay, so you're going to start in the right lower quadrant. And you're going to listen for 15 seconds. I'm going to move to the right upper quadrant. And you're going to identify, are they normal active, like we called it normoactive, hyperactive, or hypoactive? Left upper, left lower. Okay? And then the palpation, we learned to do this, but your teacher wants you to, and I just need you to tell me where it's tender if it hurts, okay? Okay, so I didn't feel any masses. That's one of the things you're looking for. You want to identify where it hurts. You want to identify if it's tender to the patient, but you're also feeling for masses or lumps or whatever. Okay, all right. And then we're going to go to the lower extremities. Okay, you can sit back up for me now. All right. Now, her shoes are off for pretending. Okay. All right. And then we're going to check for the cap refill on the toes. Less than 3 seconds. Cap refill on the toes. Less than 3 seconds. Okay. You can do the dorsalis pedis pulses, and I can feel them through her boots. And then you're going to do your tibialis post, or whatever this one is. And then you're going to do whatever the ones they want you to do here, your femoral and everything. We didn't have to. Yeah, the popliteal.
And then the femoral.
And the femoral. Which we just
Femoral. Yeah.
Is that it?
I
Those
so.
four
I
on the
think
legs?
so. It doesn't say on your sheet.
ulnar.
Yeah, and on your arms,
Oh, I
do
did
those
the arms. On the arms.
But there's only 4 at the
Yeah.
feet and legs?
Correct.
Yeah.
Okay.
Okay. And then you're gonna look at the, assess the temperature again. You're gonna look at the color, and then you're gonna check for edema. Identify whether it's pitting edema or not. Both sides, right?
So what are you looking for when you push?
If it dimples.
Yeah, any edema?
If nothing, well, this isn't. If nothing happens, you don't have any edema. If you press down and it stays down, it's pitting.
Okay.
Okay? And pitting is done by like pitting 1, 2, 3, and 4. I don't, to tell you to this day, I wouldn't be able to identify if it's 1, 2. It's kind of a judgment call, I think. But
Remember she had that little box going around?
Yeah.
Yeah.
Right, but for the health,
So if it doesn't pit at all, it's not edema?
it's non-pitting edema.
right.
So how do you know if it's non-pitting edema?
For our health assessment,
because you
it's,
press down and you can see it, and you can
Right,
tell.
but like if she had edema, how would I know that she's got it if it's not pitting?
How about this for the self-assessment?
For the health
Nobody's
assessment,
knocking it
yes.
down
Yeah.
the demon. Nobody's
Okay, I'm
knocking
worried
it
that they're
down
going to
the
ask us.
No.
No, they're not.
no,
Okay.
no.
All right, can you wiggle your toes for me? Okay. Now I need you, against my hands, to step like you're stepping on the gas pedal. Okay, and now I need you to resist me. Okay?
Go, Capri.
And then for your range of motion, I don't know what she taught you, but like we did this,
Oh, wait.
and then
Wait,
you move your leg, lift your leg for me. Can you cross
Cross.
over and then back this way? The patient does it for you on their own. That's what we did for range of motion in the lower extremities.
Is
Okay.
that
She wants
Adduction
adduction,
and
abduction, flexion, extension, hyperextension.
Abduction, you're moving away. Adduction, you're adding to the center of your body. Okay?
So that's AB, and that's AD.
AB, AD. Okay? And then, I mean, flexion, you're really doing when you're flexing, and this is flexion and extension, yeah.
Yeah, and she
So-
wanted to know that the plantar
Dorsal,
flexion, dorsal flexion. So we can do that at that time right now, probably, huh?
yeah.
Okay.
And then, let me make sure, because that's all I had, but let me see what I would add in for your guys' flow.
Then the cranial nerves and all that
The
we can
cranial
add.
nerves you would do back up here when you first came in,
Okay.
and you did the level of consciousness, and your perla and your conjunctiva and your mouth. You would add your cranial nerves in at that point in time.
With Glasgow.
Yeah. And then the last thing on here I think you have is I can't find it anymore. Coordination, the heel to toe walking, heel to shin movement. So
And
she would
gait.
get up off the table. She would show you that she could do heel to toe walking and heel to shin movement. Something else you're looking for when they're doing that is you're looking to make sure it's a symmetrical stride
And spine.
and spine. And what we did was we did the whole have her bend over and run your hand down her spine
Oh, okay.
to see.
And then see you later, right?
Yep.
That seems a little bit more,
I like that way a little bit better.
Realistic.
yeah, a little
Yeah.
more realistic than like